age, race, gender. Opioid addiction doesn't discriminate. Let's hear more about this from mental health expert, Dr. Daniel Bolber. As a psychiatrist, do you deal with a lot of patients trying to overcome the addiction?
I do, and it's funny, people have a stereotype in mind when they think of an opioid addict. They think of a junkie in an alley with a needle in their arm. But I'm seeing, this is a disease of white suburbia now. So you're seeing it in doctors and lawyers, in accountants, people who, you walk down the street every day or you're in the mall, you wouldn't think that those are the people who are addicted to it. But it's very prevalent, and it's in all sectors of society, regardless of income.
And exactly, why do you think that the stigma exists that it only affects the guy maybe on the corner of the street and not someone maybe with a PhD?
Because I think that people still are very judgmental about addiction. There's still a tremendous stigma. And I think that a lot of people see addiction as a basic character weakness instead of a medical problem like diabetes or cancer. And so when they have this sort of image in their head of this dirty person who's an addict, but it's your friends and neighbors, it's the people all around you.
Now, we discussed about it in terms of demographic. You're saying we're seeing a lot in white suburbia, but is this more a worldwide problem?
This is a worldwide problem, but it is also, I think, very much a U.S. problem, again, because of the pharmaceutical industry. And again, the pendulum has swung the other way, and heroin is really all the rage now, so to speak.
And sometimes I think when we think opioid, we also think of a lot of young kids getting their hands on these prescriptions, whether it be through their parents' cabinets. But I wonder, are they prescribed to children at all?
Rarely, but what's interesting about opioids in teens is that the opioid epidemic in teens has actually plateaued. And what's actually worse now is marijuana use and vaping. But believe it or not, there's, opioids use in teens is actually less than it was 10 years ago.
Right.
But marijuana and vaping has really become a much, much bigger problem.
Now, would marijuana and vaping be considered almost like a gateway?
In some ways, yes, but what we know about opioids is that 7 out of 10 teens who use opioids use other things like alcohol and marijuana.
Right.
And what this does is it increases the risk of overdose by central nervous system depression because they're all depressants on the central nervous system.
Right. Now, what percentage of people who use prescription pain medication actually become addicted? I think there's like a window that addiction can happen, and does it happen to everyone?
Based on your genetic potential, some people have more of an addictive tendency than others. But it's important to elucidate the concept of addiction and dependence. If I prescribe you blood pressure medication, you will become dependent. I will need to wean you off if I need to stop it. But addiction is something different. It's compulsive use despite negative consequences. So everyone who is addicted is dependent, but not everyone who is dependent is addicted.
Okay. Now, how does opiate addiction relate to other addiction issues?
Well, there is this sort of gateway theory that if you use marijuana, you're more likely to use things like opioids, and there's probably some truth to that. But again, not everyone who uses marijuana is going to be using opioids. But interestingly enough, the majority of people on opioids are also using things like marijuana and alcohol, so they very rarely use them in isolation.
Okay. Now, do they all affect the same area of the brain? How does that work?
Ultimately, it all comes down to a chemical in the brain called dopamine. Opioids affect the opioid receptor, but they cause the release of a chemical in the reward system of the brain called dopamine, which is essentially the pleasure neurotransmitter. It's the same, neurotransmitter that's released when we eat a piece of chocolate cake. But in using opioids or cocaine or other drugs of abuse, it's released in what we call supraphysiologic or much higher levels than would be released in everyday activities.
Now, let's talk about what opioid addiction looks like physically. Walk us through these signs and symptoms of someone who may be having an opioid addiction.
So we have, again, euphoria. So the person seems like they're kind of, zoned out. Sedation, their pupils are constricted. Their breathing is slowed, and sometimes slowed to the point where, they could actually overdose and stop breathing completely, which is, what we always worry about with opioid overdose.
Is that what you were mentioning as well, that sometimes your brain forgets to send the message that it's time to breathe?
To your lungs to breathe, exactly.
Oh my goodness. Now, we see also confusion. This is something that's very normal?
Confusion, and actually what I was going to tell you is with some of the fentanyl out there, the drug is so strong that there have been police officers that have actually stopped breathing, that have actually come into contact, right?
Yes.
Not even touched it, just breathed next to it. So that gives you an idea how strong it is, that they don't even have to physically touch it. Just the fact that it vaporizes into the air is enough to cause them to stop breathing.
That is so scary. Now, there are other signs that someone may have an opioid addiction problem, one of which is doctor shopping, which we talked about a little bit earlier. So that means that they go to different doctors, correct?
They go to different doctors, they may visit different emergency rooms, but in Florida, it's much harder to do that now because of the eForce database, which we can use to track doctor shopping.
Okay, and now we see here extra pill bottles, social withdrawal, which seems to be such a red flag.
Right. They're not, they're not going to their job anymore. They're withdrawing from their normal social relationships. Maybe they're isolating themselves in the bedroom. These are all red flags for sure.
And financial problems also plays, and I do want to talk about that because it's almost using all your financial resources to
acquire the drug.
The drug, and not only yourself, but family members as well.
Yeah, I mean, you're stealing, you're taking your TV and you're pawning it off, you're pawning jewelry off just to get money for drugs. Because literally in your brain is telling you use or die, use or die.
Right.
You put everything else aside, your physical health, your relationships, your job, all become a distant second to obtaining the drug.
It's important to know there is help out there for those who are suffering from addiction. You are not alone.